Okay. Good morning, everyone. My name is Brandon Lopez. I'm a senior here at Metro, part of the class of 2025. And today I'm going to present to you my senior portfolio. This is where I'll take you through my 4 years here at Metro and showcase some of my greatest work that shows both my growth and how Metro has pushed me above and beyond to help me in my future endeavors. Before we get into some of my work, I want to present to you do a little introduction of myself. As I said before, my name is Brandon Lopez. I'm a senior here at Metro, part of the class of 2025. I come from a first generation Hispanic family. In the fall and after I graduate from Metro, I plan on pursuing a degree in molecular and cellular biology at the University of Connecticut Storrs campus to pursue my dream of becoming a doctor. So, getting straight into some of my class assignments, I first want to start off with the competency problem solving and critical thinking. The piece of work I want to show here is a paper that I wrote for a dual enrollment course I took at the University of New Haven. The course title was called Introduction to U.S. Healthcare, and the title of the paper was called The Ideal U.S. Healthcare System. A little background into what this paper was about is that this was a paper that tasked me to examine why the United States spends more than any other country on healthcare, over $4.5 trillion annually, yet still have poor health outcomes. One of the big things about this paper was I was actually tasked to compare the United States to other countries such as Germany and Finland that kind of had more of a universal healthcare coverage. For this paper, I focused on things like accessibility, maternal and infant mortality, and also preventative care. My main goal here was to analyze evidence and offer a well-reasoned solution for how the United States can improve its system by learning from other countries. My self-assessment for this competency and for this paper is I would give myself an exemplary, mainly because, again, a big part of this paper was comparing the United States to other countries such as Germany and Finland. And as I was looking into these different systems and comparing these different systems, it showed how different elements like insurance structures, preventative care access, and government policy interacted with each other, showing how systemic fragmentations in the United States is actually what leads to worse health outcomes despite the higher spending. And after evaluating all my sources, I put them all together into this argument saying that the United States should create a universal healthcare system. But with that in my paper, I also said that this was much more easier said than to be done. So in my paper, I said how we should, for now, focus on smaller things such as expanding accessibility and making healthcare more affordable and focusing more on preventative care. After I submitted this paper, my UNH professor, who was also one of the heads of the physician assistance program over there, said that this was, quote, a prime example of excellent research and critical thinking. For my next competency, we have accessing and analyzing information. And for my evidence of mastery, or the piece of work I want to show here, is another paper that I wrote for this time a dual enrollment course that I took at Yale University called AI for Future Presidents. The title of this paper was called Convolutional Neural Network Deep Learning Algorithms Impact on Radiologists. And although that title can seem like a bit too much, basically what this paper was about is this was exploring how artificial intelligence is impacting the medical field, but more specifically radiology. In this paper, I was addressing public fears around AI replacing jobs and kind of instead saying how AI can actually support overworked medical professionals. For this paper, I was also researching case studies, academic journals, and health system reports to basically say how deep learning algorithms can help radiologists in terms of diagnostic imaging and reducing high error rates. So my self-assessment for this paper is I would give myself an exemplary, mainly because for this paper I was accessing and analyzing over 20 sources that included academic journals, medical case studies, government health data, and other papers. And as I was picking these sources, I was making sure to assess their credibility and their contribution to my research goals. I was mainly doing this by cross-referencing each resource and kind of seeing to make sure that there were no conflicting viewpoints and making sure that there was nothing of misinformation being put into my paper. In the end, I organized my findings into a well-supported and real-world grounded argument that connected radiologist burnout and diagnostic errors with solutions like FDA-approved AI algorithms. For the next competency, we have communication and collaboration. And for the piece of work I want to show here is a presentation that I made called the Readers Are Leaders presentations. And this was something that I did as a part of myself being a library teacher assistant here at Metro. A little background into what this presentation was about is that myself and another TA worked to create and deliver a 5-minute presentation about the benefits of reading. This was a presentation that we eventually presented to high school freshmen. And basically what we were tasked here is to identify 5 key benefits of reading supported by research. And we also had to include 3 one-minute interviews featuring current students, Metro alumni, and also people who were already in the workforce to kind of reiterate our benefits. So my self-assessment here is I would give myself an exemplary, mainly because for this presentation, we use different modes of communication such as verbal, visual, and interviews to engage the audience and effectively convey the benefits of reading. During our presentation, we were also keeping in mind who our audience was, which was high school freshmen, and we kind of focused on things like vocabulary and not using big words or jargon words that they wouldn't understand, but we were also taking into account their attention span to make sure our presentation wasn't boring and we were actually keeping them engaged and actually learning what we were teaching about them. In terms of collaboration, me and the other TA worked very well together. We were openly sharing our ideas, listening to one another, and putting it all together for our presentation. And I believe that our ability to communicate and work together effectively was a big reason to why our presentation was of high quality. So for the next competency, we have creativity and innovation. And the piece of work I want to show here is an art piece that I made for a college course that I take here at Metro called Diversity, Dispositions, and Multiculturalism. And this is a Quinnipiac University class. And this is the art piece that I made. And basically telling you a little bit more about what I was doing is for this assignment, we were tasked to create something that answered the question, what is my unique story? And what I decided to do was to talk about how I often feel very divided with both of my identities, both Mexican and American. So what I decided to do was to make a collage that represented on one side Mexican culture, on the other side American cultures and ideals, and kind of this line dividing both of them, kind of reiterating how I don't feel 100% on either side. My self-assessment for this collage is I would give myself an exemplary in creativity and innovation, mainly because when I was choosing what I wanted to do to answer the question, what is my unique story, I decided to explore the tension that I feel being both Mexican and American and how I often don't feel enough of either. During the creative process, I was kind of letting my experiences do it for me, because although talking about myself wasn't really new, the artistic side of it was. So what started as a personal challenge became a way to make my story visible, and I hope others who feel in between, not just in cultural identities, but whatever it is, can kind of relate to this and feel seen. All right, so for the next competency, we have initiative, self-direction, and accountability. And my evidence of mastery here is a CNA course and an EMT course that I took during my high school years. And a little background into this is, first, my CNA course is something that I did during my junior to senior summer from Monday through Fridays from 7 a.m. to 3 p.m. every week for my summer. It took a lot of commitment and in-person skills, sessions, lectures, and also eventually clinicals that I did at a local nursing home. And on the other side, we have my EMT course that I did during my senior year that took a lot more of my time. I was completing hours of modules every day. I was doing online sessions 3 times a week, and I was attending in-person sessions every Saturday. And my self-assessment in terms of initiative, self-direction, and accountability is that I would give myself an exemplary, mainly because both taking a CNA and an EMT course as a high school student can be very challenging, both mentally and physically. I think during my EMT course, I was doing a lot of stuff, such as studying for the SAT, applying to college, and doing all these other things. So I think time management skills and kind of keeping myself on pace was a big thing that I had to do here. But in the end, I took responsibility by staying disciplined, reflecting on my performance, and seeking help when necessary. And I think that these experiences strengthened my commitment to lifelong learning and self-directed growth. So for the last competency, we have citizenship and responsibility. And what I want to show here is a financial reality fair that I did as part of being in the Future Business Leaders of America, or FBLA chapter at Metro. And a little background into what this is as a part of FBLA, we decided to do a community service project here at Metro that kind of addresses the low levels of financial literacy among our students. We developed a hands-on interactive simulation where participants navigated real-life decisions such as budgeting, like rent, groceries, and loans. Our goal here was to empower students with the financial skills they'll need after graduation. And additionally, Our initiative received recognition from the Connecticut FBLA chapter at the state capitol and was presented in a report at the FBLA state competition. My self-assessment in terms of citizenship and responsibility is I would give myself an exemplary, mainly because through our financial reality fair, I demonstrated an in-depth understanding of a complex community issue, which is financial illiteracy among high school students, and took a responsible, constructive, and meaningful action to address it and benefit others. By recognizing how this issue impacted my peers, especially those from underrepresented backgrounds, I acted with empathy and respect for diverse perspectives. Also, when we were doing this and when we eventually went to the state capitol to talk with local state representatives, um, both myself, the president of the FBLA, and our advisor, Ms. Gracie, advocated for more financial literacy in high schools and middle schools in New Haven. So I think that's definitely a big part into what citizenship and responsibility is about. So moving on from competencies in some of my work, I want to talk about my community service and internship. In terms of my community service, what I did was I completed over 300 hours of community service that was all here in New Haven. Most of this came from FBLA with our financial reality fair, but also a majority of this came from another initiative called Toys for Tots. And basically, if you didn't know what this was, is that this is a seasonal thing that we usually do during the fall and winter times, where we would go around and do these toy drives to collect toys and drop off toys at certain centers and kind of give them out to children who during the times probably couldn't afford toys. And in terms of my internship, that's something I completed during my junior year that I did at the Yale New Haven Hospital, and I worked as a patient transporter. And as the name says, I was transporting patients all across the hospital. I was talking to doctors, nurses, and other professionals there, and I kind of got this exposure into the medical field and how it is to work in a hospital. And with that, that concludes my presentation. Any questions?